For 4 million Canadians across the great province of Ontario, they have the humbling and renowned privilege of calling themselves caregivers. For a family member, friend, or someone they care for in a professional capacity. Optimizing the mental, physical, and emotional health of caregivers is essentially important to ensure that they can show up as the best version of themselves when caring for those they're responsible for. And there's one specific organization who is responsible for extending such an olive branch of camaraderie and support. The Ontario Caregivers Organization aims to provide the supportive resources necessary to support caregivers during their mental and emotional journey in their official capacity as caregivers, providing them resources to succeed and excel, both as caregivers and individuals at large. And Amy Kupel is the organization's Chief Executive Officer, and she joined me to have a wide-ranging discussion all about what her organization does on a routine basis to support the needs of caregivers. And our conversation starts right now. Amy, I want to welcome you to the Speak Up podcast this afternoon, and I'm delighted to see you and learn all about the good work that you do at the Ontario Caregivers Organization. Great to see you this afternoon, and thank you so very much for being here.
Good to see you too. I'm delighted to be here and really looking forward to our conversation.
Absolutely. So, Amy, I know that your organization aims to support and give the 4 million caregivers in Ontario, whether they take care of people from a personal or professional capacity, the support resources that they need to be emotionally, physically, and mentally strong. So I'm wondering if you can tell me all about the great work your organization does and the critical lifeline of support that you offer to caregivers.
Well, you provided a great introduction to that. At the Ontario Caregiver Organization, we do support Ontario's estimated 4 million caregivers. So these are usually family members, friends, or neighbors supporting someone with physical, mental health, emotional, spiritual support that they need throughout their lifetime. And I always say that, there's 4 million caregivers in the province and 4 million unique caregiving experiences that people are having, because each person who is receiving care has a unique set of needs, and each person who's providing care comes with their own set of circumstances in their lives. So at the Ontario Caregiver Organization, we have a wide range of programs and services for caregivers, everything from our 24/7 helpline, which is available in English and French, and we also have translation in over 100 languages for people who need support at any time. And then we have a number of services that we offer to caregivers, whether that's matching them with a peer mentor, connecting them with a peer support group. We have coaching, we have counseling, and then we also have things like our webinar series and a wide range of learning resources for people who are looking to deepen their learning or understanding on a specific topic. So we hope that we have something for everyone.
Yeah, absolutely. And, I wanted to take a moment just to talk to you about the critical work that you do to really reduce caregiver burnout and enhancing the caregiver experience. And I know that there's a lot that goes into that, and you've got existing services that strive to do that. So that are accessible to all caregivers, regardless of their age or regardless of what sort of person that they're caregiving for. So talk to me just for a moment about the critical importance when it comes to reducing caregiver burnout.
You know, it's interesting that you flag burnout because this is one of the key numbers that we track year over year. And one of the things that's concerning us as an organization is that we continue to see that burnout number rise each year when we do our annual spotlight report. And so what does that mean for us broadly as a society? It means there's a whole group of caregivers who are feeling challenged to continue with the caregiving commitments that they've made. And so that is something we should all pay attention to. But at an individual caregiver level, we hear from caregivers that there is a whole group of caregivers who are saying, I am struggling to keep going. I'm facing overwhelm, loneliness, isolation, depression, and all of those things contribute to this overall picture of caregiver burnout. And we want to make sure that the kinds of supports that we have for caregivers can give that scaffolding, right? Where as they're facing challenges, they feel like they have somewhere to go for support, or maybe the challenges feel a little more manageable because they've had some tools or information that helps them along the way. We also connect caregivers with supports in their local community. So if there are things that they need that maybe we can't provide as an organization, we work with our health system partners to connect people with the things that they need. And all of that is really in service of reducing burnout and helping caregivers feel like they can balance their caregiving responsibilities with perhaps other family commitments, work commitments, or other personal commitments that they have.
Yeah, absolutely. And I mean, I want to talk for just a moment about supporting the emotional well-being of caregivers and what advice you would give to family members who have the unique and humbling opportunity and responsibility to be a primary caregiver, but also to know that they have value, and particularly if the people that they're caring for have disabilities. What sort of advice would you give to caregivers who might be watching or listening to this afternoon?
You know, my number one piece of advice would be to know that you're not alone. I think one of the biggest things that caregivers experience is this sense of loneliness and isolation. And as a caregiver, I've experienced that too. We don't talk a lot about this necessarily in our communities or in our families. Some people do, but a lot don't. And so it can feel like, am I the only one? Or am I the only one who's facing the challenges of balancing these commitments? So I would definitely say to people, you are not alone. And I would also say that connecting with the supports that you need, and that can be different for each person, can really, really make a difference. I think too, sometimes we forget what you rightfully acknowledged is this emotional component of caregiving. And it's one of the reasons why we have another program I haven't mentioned yet called SCALE, which is about caregiver learning and empowerment. And one of the things that we talk about in that program is that there are a range of emotions associated with caregiving, and having the chance to acknowledge those things, share with other caregivers, have validation of all of the types of feelings that may arise is an important part of supporting people along their caregiving journey.
Yeah, and then tell me about sort of really valuing yourself and reconnecting with yourself as a caregiver, and how important is it that you think that caregivers don't lose who they are?
Well, I think it is often the first thing to go, unfortunately. And I can say this from my own experience with more intense periods of caregiving that, you know, if you're going through the prioritization, sometimes we'll sacrifice ourselves first. But I've also learned, and many caregivers tell us this as well, that if I don't keep the gas in my own tank, if I don't do the things that I need to fulfill my own personal responsibilities, to take care of my own health and wellness, it's going to affect my ability to be a good caregiver. And so, you know, there are a lot of discussions amongst caregivers about this concept of self-care and whether or not that's a good thing or a bad thing, and people have different thoughts and feelings about that, which I truly honor. But for me, what I know is that idea that you hear on the airplane of you got to put your own gas mask on first before you help someone with their oxygen mask. We need to do the same thing in caregiving. We've got to have our needs met, sleep, nutrition, spiritual care, whatever it is for someone that is going to allow them to continue in the caregiving role. And look, for most of us, caregiving is a journey that happens over time. And so there are peaks and valleys. I know that. But the more we can do to get the support for caregivers to continue in that journey, the better.
Yeah, absolutely. And Amy, I know that all of your work is guided by sort of giving the caregivers a voice. And I'm curious if we can dive into what do you think it means to give the caregiver a voice?
Yeah, that's a great question. I'd like to address it in two ways. One is, we really embrace this philosophy of nothing about us without us. So caregivers are a part of the creation of our OCO programs, the delivery of the content that we develop, the development of things like our strategic plans. Caregivers are a part of our work on an ongoing basis. But also, we know that part of what caregivers want from us is to inform the changes that are happening in the healthcare system. And so it's important for us as an organization to amplify those caregiver voices at those tables where those conversations are taking place. So how do we have caregivers represented well at Ontario health teams? How do we have them represented well within hospitals or long-term care homes or other congregate settings, other places where healthcare is taking place? And so we want to make sure that we're contributing positively to the healthcare system and saying, caregivers are a part of the healthcare team, and it's important that they're a part of the table in individual care planning, but also broader planning around health system transformation and how we can improve the experience of healthcare for everybody and improve everybody's quality of life, because we access healthcare so we can live, right? And so we want that to be a good balance for the person receiving care and for the caregiver.
Yeah, and Amy, as you know, here in Windsor, the John McGivney Children's Center supports children and their families with physical and developmental disabilities and their families. And, sometimes when you raise a child with special needs as a parent, the emotional and financial impact can be overwhelming at certain points. So I'm curious, how do you think parents who raise children with disabilities can really make sure that they're putting themselves first and not always feeling the amount of guilt that may come from not putting themselves first and really showing up as the best version of themselves as they care for their loved ones with disabilities?
Yeah, I think it's such a good question. A lot of this comes down to communication, right? Communication within families, communication with caregivers as a part of the team. And so that's a way that we can recognize that caregivers are whole people in the equation of their caregiving role. Many parents who would be caregivers of children who would be accessing the kinds of services that your center has might be working parents. They might have other children in family as well. And so looking at how do we center the solutions and things that are happening in a way that enables the person receiving care to get the best care that they can, but also that balances the responsibilities that the parents are taking on as caregivers, but probably, maybe at a job, as a parent to other kids. How do we balance those things? I think this comes back to your really important question about emotions. And caregivers sometimes are reluctant to acknowledge things like guilt or fear or grief, and sometimes that grief is things like, this sense of loss of things that they wanted to be able to do and they couldn't because it got interrupted for some reason or another. And I think we've got to honor the range of experiences that people have, and that often caregivers are a part of a circle of care. So in the case of parents, there may be one or more parents, step parents, siblings, grandparents who are part of the circle of care. And how do we coordinate care within that circle of care so that those primary caregivers, who probably would be the parents, get the support that they need? But I love the circle of care approach in terms of saying who's involved here and how do we find the balance for everybody.
Yeah, absolutely. And I mean, just one follow-up on this question about parents and caring for kids with disabilities. Can you talk for just a moment about the importance of connecting with other like-minded people who are in the space of caregiving for a child with a disability, and how important is it to really create that social capital as parents as well?
Yeah, I mean, what we hear consistently from people is that peer support is an absolute lifeline for caregivers. And so if there is an opportunity to connect with a mentor, with a peer support group, other parents experiencing similar kinds of things, that this can really normalize and give voice to some of the unspoken things that maybe need to be spoken. I love that you described that as social capital, because I think that it is that very much so. And I've talked to parents where we've recommended connecting with some of those support groups, and one of the most common things that I'll hear is, I don't have the time. But for the people who can carve it out, it yields a reward of giving them more energy and more time to do the things that they're committed to doing. So I really think connecting with other parents with similar or relatable kinds of experiences can make the difference. The other thing is, we know there are an amazing group of people who are willing to take on that mentorship or that support goal, who are at another stage of their journey. And I am humbled on the regular by caregivers willing to give back to other caregivers to support them along their way.
Yeah, absolutely. And I mean, I'm wondering if you can talk specifically about the resources and sort of the information that may be available for caregivers and parents, specifically of children with disabilities or special needs. What are your thoughts there?
Yeah, what I would encourage people to do is visit our website at ontariocaregiver.ca. They can find information on a range of topics that would be relevant. And what we've endeavored to do is provide content in so many different kinds of formats. So if people want to watch a playback of a webinar, listen to our own podcast, see some of the tip sheets that we have, we endeavor to have something for everyone. One of the new approaches that's coming up for us just next month is short form content. So we know sometimes taking the time to watch a playback of a full webinar, people may not have an hour, but if we can chunk that into bite-sized pieces, then we'll have even more opportunities for individuals to come and check out that content. So for parents of children with disabilities, we have some webinars that would be directly relevant, where we have people with lived experience talking about their own experiences. We have researchers who talked about some of their insights that may be relevant to parents within this community. And then we also have segments of our website that would be relevant as well. And our website is actually going through a relaunch next month, so we'll have even more new content, including that short form content that will help people to kind of always come back and find something new. One other piece that I would recommend, Kevin, is our 90-second caregiver. For caregivers who just say, I don't have time, I don't even have time to watch a 3-minute video, we have a newsletter that comes out once a week. It takes 90 seconds to consume that content. So if all you have is 90 seconds, we'll give you some pro tips. We'll talk about some of the topics that are relevant to caregivers, and we'll also refer them out if they want to know more. So that's a great place to start. People can sign up for that on our website at ontariocaregiver.ca.
Yeah, absolutely. And evidently for parents who may be looking for information that's not on your website, I'm curious, what are some suggestions that you might offer to them?
Well, if they are not finding what they need on the website, they could also call our helpline. That's available 24/7. And the benefit of the helpline is you get a live person on the other end, and you can talk about your specific questions or your specific needs. So if people aren't finding what they need, I would recommend that. Now, that helpline will not only help connect people with information from the Ontario Caregiver Organization, but it will also connect them with other resources in their local community. So for folks who may not know about different associations or organizations, we'll try and connect them with those groups, because we certainly know we can't provide all the support, and we want to provide direction to get to organizations that may very well be relevant to, for example, parents of kids coming through the center. So that's another way that people can connect with support. And then, of course, we're always cross-pollinating information on social media. So you can check us out on Facebook, Instagram, Twitter, and LinkedIn.
Absolutely. And I'm curious to ask you about some of the feedback that you've received from parents raising children with special needs, and about the programs and supports that you provide. What's been the public perception to the mission of your organization since it started back in 2018?
Well, if I had to tell you the most common thing that I hear from people, it's that they wish we were here sooner. So, we are a relatively young organization, and we still have caregivers who will find out about us who've been on the caregiving journey long before we started out as an organization. And they often wish, geez, I wish I had a support like this in the early days. And we do have some resources for brand new caregivers, tip sheets, self-assessments, those kinds of things. So that's probably the most common thing that we hear. But the other thing that we hear is that people need different kinds of supports along the way in the caregiving journey. And this is where, we have some group counseling sessions, for example, where you might get to hear about other people and their different types of experiences. And I think if I could wish for one thing for caregivers, it would be to break down some of those isolation barriers and hear about other people's experiences, get the benefit of providing them with some support, and the benefit of getting support for yourself. Because it is so easy to say, I don't have time for this, or I've got it covered. But once you face burnout, as many caregivers do, then it becomes an urgent need. And if we can prevent that by connecting people with a community and with support, including local services in their own community, then it can really help people along the way.
Yeah, absolutely. And Amy, you spoke earlier about your peer support programs. So if people in my region of the country of Windsor and Essex County wanted to become a peer mentor, what's the best way they can get involved with the program?
We have a peer mentor application process on our website. They can check that right out on our website at ontariocaregiver.ca. We will guide people through the process, and we will match them with a mentee who is perhaps having a similar type of experience, or maybe that person wants to relate to somebody from a totally different kind of experience. But we will guide them, and we will also provide training. So we'll provide training for peer mentors on not only the mentorship process, but on key topics that can come up over time. As an organization, we're also committed to building our collective capacity around equity, diversity, inclusion, and accessibility. And so we will do little micro trainings on different topics so that we're constantly improving our understanding about things like microaggressions, for example, and how to avoid those. So we will offer volunteers ongoing training so that it can help inform those conversations as well.
Yeah, absolutely. And every issue you may experience, male caregivers may be hesitant sometimes to reach out for support as caregivers and belonging in such a ethnic group when we're talking about male caregivers. I'm curious to ask you about how do you think we can attract more male caregivers to the profession, and what would be your advice for any male caregivers who may be hesitant or ashamed to ask for help? I'm curious to get your thoughts there.
I do think this comes back to the normalizing piece again. If you look at the national stats, they're actually fairly balanced in terms of male caregivers and female caregivers. But you only have to go one level deeper than that to recognize that female caregivers are spending more time and are taking a greater financial penalty in terms of the cost of caregiving and perhaps implications on their career as well. So for male caregivers, I think it is first and foremost about saying, you're out there and you're not alone. I did an interview not that long ago with a construction magazine. And one of the interview questions was, we work with tough guys. They're not caregivers. And I said, well, if you have a family member who has some kind of caregiving need, they probably are a caregiver. They're just not acknowledging it. So this is where recognizing that caregivers come in every way, shape, and form that people come. They're in every community across our province. They come from every cultural background, and they certainly come from any gender. And so that normalization piece is really important. And then it's about seeing examples of people being willing to talk about this. And we have some great caregivers who have done presentations on this for our webinars, speaking events, etc., who will talk about their caregiving experiences as male caregivers so that people can see other examples and say, oh, well, if he can acknowledge he's a caregiver, maybe I can too.
Yeah, absolutely. And Amy, I'm curious to finally ask you about just circling back to our previous discussion on overcoming overwhelm as parents, as someone with a disability. I'm curious, what would be your pieces of advice for parents specifically who are raising kids with disabilities or special needs about avoiding or effectively managing burnout?
I always say that caregivers are the best project managers, the best communicators, the best planners, because in order to manage some of that overwhelm that you're talking about, you do need to map things out. And I know as a caregiver myself, one of our tools is a spreadsheet, and we, we map commitments, responsibilities, information. And this is part of my circle of care as well, so that everybody has access to the same information. So in order to manage that overwhelm, we have things like checklists that can help people look at all of the different domains of caregiving, whether that's medication management, appointment scheduling, whatever the case may be, and really looking at all of the functional things that need to be done, and also those emotional, spiritual, personal things that need to be taken care of as well. So planning is your best friend, and communication is your next best friend, because I do think the more we talk about this within our care teams, within a circle of care, that can really help with the overwhelm. And then the other thing I would say is, what is the emergency or the contingency plan? So, for example, if the caregiver reaches that point of burnout and needs a break, what's the plan that kicks in? Or if something unexpected happens and there's a trip to the ER, what's the plan that kicks in? So having that ready ahead of time so that somebody can say, all right, I need this help now, that everything is mobilized and documented, then it can help to lessen some of that overwhelm.
Yeah, and Amy, as you've mentioned a couple of times throughout our conversation, you're a caregiver yourself. I know that you're currently caring for your brother and your elderly parent as well. So I'm curious, what sense of pride do you take leading this organization as it looks into the future and the forward thinking a vision of where you want to take the organization moving forward? So why are you passionate about the work that you do?
Well, like many caregivers, I was a caregiver long before I knew that's what I was. I was doing this because I was a sister, because I was a daughter, and I was doing it because of my commitment to those relationships. And most people do. Most people don't say I'm a caregiver because they say I'm doing it because it's my sibling or it's my child or it's my parent, it's my neighbor. This has been a lifelong journey for me. I've always been a caregiver as long as I've been able to participate in a circle of care. And it has been incredibly fulfilling for me to combine my professional experience with my personal experience of caregiving to provide support to people who otherwise wouldn't have had it or otherwise might have felt very alone. And so, we hear from caregivers regularly about the things that they want OCO to continue to do. They want us to have caregiver voices at the table more as plans are being made provincially, as the health system is transforming. And they want to make sure we have more supports for caregivers within the context of all of the places that care is being received. They want to make sure that they're recognized as a part of the care team and that we have safety nets to catch people when they run into challenges or have greater needs. So I feel incredibly motivated to continue to do that work. And I feel very personally connected to it because of my ongoing caregiving commitments. And, there are going to be more caregivers taking on these responsibilities based on the changing demographics in our population. And so it's a really important time to be doing this work because we have to recognize that caregiving is happening in every single community and for lots of different reasons with lots of different people. And we want to be sure that we have something for people, no matter where you live in the province, no matter who it is you care for, and that may be more than one person, and no matter what those needs are now or in the future.
Yeah, and finally, Amy, I'm wondering if you can remind our audience about the website and all the great resources that are on it. So how can people get in contact with you if they're so inclined to do so?
Best thing to do is to visit us on our website at ontariocaregiver.ca. You can find the phone number for our 24/7 helpline. You can find all the playbacks of our webinars, our own podcast. You can register for any of our programs, the SCALE program, Caregiver Learning and Empowerment, peer mentorship, peer support group, peer coaching, so many different ways that people can access support. We also have lots of self-directed information. So if people don't want to sign up for something where they need to participate or listen at a certain time, we've got lots of self-guided information, resources, and supports that people can access. So we really hope that we have something for everybody. And if we don't, we also want you to let us know. So on our website, you can let us know what content is missing or that you'd like to see us generate. And we'll just keep that dialogue going because we're very invested in hearing from caregivers, and we love working in partnership with other organizations to close the gaps on information and support that people need. So come and check us out at ontariocaregiver.ca.
Absolutely. And Amy, I have to tell you that I was delighted to engage in conversation with you about the critical work that you do as your organization to support the emotional, physical, and mental needs of caregivers, my friend. I want to thank you for the good work that you do and to move the needle of progress forward in this very important initiative, my friend. And I want to thank you for being here this afternoon. It's most appreciated.
Thank you so much for having me. I have truly enjoyed this conversation and looking forward to continued dialogue with caregivers who are connecting through the podcast and with you.